What if the answer to everything that has been silently destroying your body, your energy, your mood, your metabolism, your hair, your skin, your entire life, was staring directly back at you every single morning in your mirror, and you had absolutely no idea? What if the face looking back at you was desperately trying to send you a warning, a signal, a cry for help? And the only reason you missed it was because nobody ever taught you how to read it? Right now, as you watch this, there are millions of people walking through their days completely exhausted, gaining weight despite barely eating, losing their hair in clumps, feeling cold when everyone around them feels perfectly fine, battling depression that no antidepressant can touch. And every single doctor they visit tells them their results look normal. But here is the terrifying truth. Normal is not always fine, and your mirror knows the difference before any lab test ever will. Today, I am going to show you 15 signs that your thyroid is failing. Signs you can see with your own two eyes. Signs that could change your diagnosis, your treatment, your energy, and ultimately your entire life. So do not look away. Your mirror has been trying to tell you something. It is finally time to listen. What if the most important medical appointment you will ever have costs you nothing, requires no insurance, no waiting room, no blood draw, and happens every single morning in the privacy of your own bathroom? What if all you needed was 2 minutes, honest eyes, and the knowledge of exactly what to look for? Because your body has already been writing the diagnosis on your face, your skin, your hair, and your hands for months, possibly even years? What if I told you that hypothyroidism, one of the most common yet most catastrophically underdiagnosed conditions on the planet, leaves fingerprints all over your physical appearance, long before any standard blood test will ever flag it as a problem? And what if the reason millions of people are suffering in silence right now is not because the signs are invisible, but simply because they do not know what those signs actually look like? Today, we are going to change that completely, permanently. Because knowledge is not just power. When it comes to your thyroid, knowledge is the difference between living fully and slowly disappearing from the inside out. Let us begin. The first sign you can see in your mirror is the face itself. Specifically, a puffy, swollen, almost bloated appearance that has nothing to do with sleep or water retention. What if the puffiness you have been blaming on poor sleep or too much sodium for the last several months is actually your body screaming that your thyroid has stopped working properly? When the thyroid gland produces insufficient hormone, a substance called mucin begins accumulating beneath the skin. This is not ordinary fluid retention that responds to diuretics or dietary changes. This is a thick, gel-like deposit that settles particularly around the face, giving the cheeks a doughy, swollen appearance that feels almost firm to the touch rather than soft and squishy like typical water retention. The medical term for this is myxedema, and it is one of the most visually striking signs of severe hypothyroidism. People living with this condition often report that friends and family comment on how their face looks different or changed without being able to articulate exactly why. The jaw appears heavier, the cheeks appear fuller, and the overall facial structure seems somehow blurred, as though the sharpness and definition of your natural features has been slowly erased. What makes this sign so shocking is that many people spend years treating this puffiness with expensive skincare products, facial massage techniques, and dietary restrictions, never once suspecting that a tiny, butterfly-shaped gland in their neck is the true architect of the transformation happening to their face every single day. The second sign is something almost nobody talks about: the disappearing outer eyebrow. What if the thinning you have noticed at the outer corners of your eyebrows is not a cosmetic problem, but a clinical red flag? This particular sign is so specific to hypothyroidism that many experienced clinicians consider it one of the most reliable visual indicators of underactive thyroid function. The outer third of the eyebrow, the portion closest to the temple, begins to thin, sparse out, and in some cases disappears almost entirely. This happens because thyroid hormone is absolutely essential for the normal growth cycle of hair follicles throughout the body, and the follicles at the outer eyebrow are particularly sensitive to hormonal disruption. People often begin filling in this area with makeup, never connecting the cosmetic concern to an underlying metabolic crisis. What is truly alarming is that this sign can appear years before other symptoms become obvious, making it one of the earliest visible warnings your body will ever give you. The eyebrow hair that disappears due to hypothyroidism has a distinctive pattern. It does not thin evenly across the entire brow the way aging-related thinning might occur. Instead, there is a very clear, almost sharp line of demarcation where the hair simply stops, leaving the inner two-thirds of the brow relatively intact while the outer section becomes nearly bare. If you look in your mirror right now and notice this pattern, please do not reach for your eyebrow pencil before you have spoken to a physician about your thyroid levels. The third sign lives in your eyes, and it is more complex and more dangerous than most people realize. What if the slight puffiness you see around your eyes every morning, the heaviness of your upper eyelids, and that perpetually tired expression that no amount of sleep seems to resolve is your thyroid leaving its signature on your face? In hypothyroidism, the tissues surrounding the eyes, both above and below, become infiltrated with that same mucin substance responsible for facial puffiness, creating a characteristic appearance of periorbital edema, which means swelling around the eye socket. The upper eyelids appear heavy and drooping, giving the eyes a half-closed, perpetually sleepy appearance. The lower eyelids develop a puffy, baggy appearance that does not respond to cold compresses or adequate hydration the way ordinary morning puffiness does. But what is truly shocking about the eye changes in hypothyroidism goes beyond mere puffiness. The eyes themselves can appear somewhat sunken within this swollen tissue. And in some individuals, the eyebrows descend slightly as the forehead tissue becomes heavier and less elastic. People spend extraordinary amounts of money on eye creams, under-eye treatments, and even cosmetic procedures to address what is fundamentally a hormonal deficiency that could be addressed with a simple medication taken once daily. The eyes have been called the windows to the soul, but in the context of thyroid disease, they are also windows to your metabolic health, and they are worth examining very carefully. The fourth sign is written all over your skin, and the story it tells is both visible and deeply unsettling. What if your skin has been trying to tell you for years that something is catastrophically wrong inside your body, and the only reason you missed the message is that you attributed every symptom to something else entirely? In hypothyroidism, the skin undergoes profound and multi-layered changes that are entirely visible to the naked eye. The skin becomes abnormally dry, not the kind of dryness that responds to moisturizer, but a deep, persistent dryness that seems to come from within, creating a rough, almost sandpaper-like texture, particularly noticeable on the elbows, knees, and heels. The skin loses its natural luminosity and begins to appear dull, flat, and almost grayish or yellowish in tone. This yellowing, which can be particularly visible on the palms of the hands and the soles of the feet, occurs because a sluggish thyroid impairs the body's ability to convert beta-carotene into vitamin A, causing carotene to accumulate in the skin. The skin also becomes notably cool to the touch, reflecting the metabolic slowdown that hypothyroidism causes throughout the entire body. Fine lines and wrinkles may appear to deepen more rapidly than expected for a person's age, and the skin loses the plumpness and elasticity that adequate thyroid hormone normally supports. Many people with undiagnosed hypothyroidism spend thousands of dollars annually on premium skincare, dermatology visits, and anti-aging treatments when the foundational solution lies in addressing a hormonal deficiency that costs very little to treat once properly diagnosed. The fifth sign is your hair, and what is happening to it should genuinely alarm you. What if the hair loss you have been experiencing is not genetic, not stress-related, not a result of your shampoo or heat styling, but a direct consequence of your thyroid failing to produce the hormones that keep your hair follicles alive and actively growing? Hypothyroidism causes a form of hair loss that is distinctly different from pattern, baldness, or ordinary stress-related shedding. In thyroid-related hair loss, the entire hair follicle enters a prolonged resting phase and fails to return to the active growth phase in the normal cycle. The result is a diffuse, generalized thinning across the entire scalp rather than a receding hairline or distinct bald patches. The hair that remains becomes brittle, dull, coarse, and almost straw-like in texture, losing the shine and resilience that healthy thyroid function normally maintains. You may notice dramatically increased hair on your shower drain, on your pillow, on your hairbrush, amounts that seem shocking and frightening. The hair may also change in texture before it begins falling out, becoming dry and rough, even with proper conditioning. In severe cases of long-standing undiagnosed hypothyroidism, the hairline itself can recede. Body hair, including leg and arm hair, may thin significantly, and even pubic hair may become sparse. This is your body, systematically redirecting its diminishing hormonal resources away from what it considers non-essential functions. And unfortunately, it considers your hair non-essential when survival is at stake. The sixth sign is found in the color and condition of your lips and tongue, and what you might see there is medically significant in ways that are deeply surprising. What if the paleness of your lips, the dryness at their corners, and the strange thickness you might notice in your tongue are all pieces of a single thyroid-related puzzle that has been right in front of your face. Quite literally. Every day? In hypothyroidism, the lips often become notably pale, lacking the natural pinkish color that good circulation and adequate oxygenation provide. This pallor occurs because hypothyroidism frequently leads to anemia, as thyroid hormone is essential for the production of red blood cells. The lips may also appear dry and cracked in a way that does not respond adequately to lip balm, reflecting the generalized skin dryness that pervades the entire body when thyroid function is compromised. But perhaps the most startling and least discussed oral sign of hypothyroidism involves the tongue. In significant hypothyroidism, the tongue can actually enlarge, a condition called macroglossia, causing it to appear thick, swollen, and sometimes with scalloped indentations along its edges from pressing against the teeth. This enlarged tongue can contribute to speech that sounds slightly slurred or slower than normal, and can even cause snoring and sleep-disordered breathing. Some individuals notice that their voice has become noticeably deeper, hoarser, or slower, a direct result of both tongue enlargement and the accumulation of mucin deposits around the vocal cords. Looking at your lips and tongue in the mirror takes less than 30 seconds, but what you see there could tell you something that years of doctor visits may have entirely missed. The seventh sign is the nail, and specifically the changes happening to your nails that you have probably been attributing to everything except the one thing that is actually causing them. What if your brittle, slow-growing, ridged, and discolored nails are not a result of nutritional deficiency, harsh cleaning products, or aggressive nail filing, but are instead a direct reflection of a thyroid gland that has been underperforming for months or possibly years? Healthy thyroid function is essential for normal nail growth and nail plate integrity, and when thyroid hormone levels drop, the nails begin to reflect this metabolic slowdown in several very visible ways. The nails grow significantly more slowly than they should, and when they do grow, they are thin, brittle, and prone to splitting and peeling in layers. Longitudinal ridges, running from the base of the nail to the tip, become prominent and pronounced. The nails may develop a characteristic concave shape, curving inward rather than maintaining the normal gentle outward curve. The nail color can change, becoming dull, yellowish, or developing a slightly bluish tinge at the base, reflecting compromised circulation. In some cases, the nails lift away from the nail bed, a condition called onycholysis, creating a separation that creates pockets vulnerable to infection. The cuticles often become dry, ragged, and prone to tearing. People spend years visiting nail salons, trying strengthening treatments, and avoiding certain activities to protect their fragile nails, when the answer has never been about the nails themselves, but about the hormonal environment in which those nails are trying to grow. The eighth sign requires you to look at your neck, and what you might see or feel there is one of the most direct visual indicators of thyroid disease. What if the slight fullness you have noticed at the base of your throat, the button at the collar of your shirt that has become harder to fasten, or the subtle change in the contour of your neck that you keep dismissing as weight gain is actually a visible enlargement of your thyroid gland itself? A goiter, which is simply the medical term for an enlarged thyroid gland, can sometimes be seen directly in the mirror as a swelling at the front of the neck, just below the Adam's apple in men or at the base of the throat in women. In some cases, the enlargement is subtle and only becomes visible when you tilt your head back and swallow, watching the neck in a mirror as you do so. The swelling will move upward with the act of swallowing, which distinguishes it from other causes of neck swelling. In more advanced cases, the goiter can be quite prominent, creating a visibly distorted neck contour that is impossible to overlook. What is important to understand is that not all hypothyroidism causes a goiter, and not all goiters indicate hypothyroidism. But when a goiter is present alongside other symptoms on this list, it becomes a highly significant clinical finding that demands immediate medical attention. The neck does not lie. When the thyroid enlarges, it is trying to compensate for its own dysfunction by growing larger in an attempt to produce more hormone. And that compensatory struggle is visible right there in your mirror if you know what to look for. The ninth sign is written in the pallor of your skin and the slow, subtle disappearance of your natural complexion. What if the increasing paleness you see in your face, the loss of that healthy color, the grayish undertone that seems to have replaced your natural skin tone, the way your complexion appears almost washed out in photos that would never have looked that way before? Is your cardiovascular system and your thyroid system speaking to you simultaneously through the language of color? Hypothyroidism contributes to anemia through multiple mechanisms. It impairs the absorption of iron from food, reduces the production of erythropoietin, which is the hormone that stimulates red blood cell formation and slows the overall metabolic processes that maintain healthy blood cell production. The result is a pallor that affects not just the skin of the face, but also the inner surfaces of the eyelids, which in a healthy person should be a robust pink color, but in someone with thyroid-related anemia become noticeably pale or even whitish. This pallor may be accompanied by a subtle yellowish tinge from the keratin accumulation mentioned earlier, creating a complexion that appears neither healthy pink nor dramatic yellow, but instead an unsettling, washed-out combination that registers subconsciously to people around you as something being off about your appearance, even when they cannot name exactly what has changed. Pulling down your lower eyelid and looking at the inner surface takes 3 seconds in the mirror. That 3 seconds could tell you something profoundly important about what is happening inside your body. The 10th sign is visible in your posture, your movement, and specifically in the subtle but real slowing of everything your body does. What if the way you carry yourself, the slowness that has crept into your movements, the slightly stooped posture that you have noticed in recent photographs, and the way your facial expressions seem to have become less animated and more flat are all manifestations of a nervous system and muscular system that are being starved of the thyroid hormone they require to function at normal speed? Hypothyroidism causes a global slowing of neurological function that becomes visible in physical ways. The facial expressions lose their normal rapidity and range, creating a mask-like quality to the face. Not the frozen mask of Parkinson's disease, but a subtle flattening of emotional expressivity that people around you may have noticed and described as you seeming distant, tired, or not yourself. The speed of speech may slow, the voice may deepen and become somewhat monotone, and responses in conversation may come more slowly than they once did. Muscle movements throughout the body become sluggish, and the reflexes, which physicians test by tapping the knee or Achilles tendon, characteristically slow in hypothyroidism, something so distinctive that doctors have a specific name for it: hung reflexes or delayed relaxation phase. Your entire physical presentation in the world, the way you walk, gesture, speak, and express yourself, is governed partly by your thyroid, and when that gland fails, the slowdown is written into your every movement in ways that a careful observer can see and that you yourself can notice if you pay close attention to your mirror. The 11th sign is found in your body weight and the particular distribution of fat and fluid that hypothyroidism creates. What if the weight you have been gaining despite eating carefully, exercising when you can find the energy, and doing everything that should theoretically result in weight loss is not a failure of willpower or metabolism in the conventional sense, but a direct pharmacological consequence of insufficient thyroid hormone in your bloodstream? Hypothyroidism slows the metabolic rate, sometimes by as much as 30 to 40% in severe cases, meaning your body burns significantly fewer calories at rest than it should. But the weight gain in hypothyroidism has a specific visual character that distinguishes it from ordinary weight gain. There is genuine fat accumulation, yes, but there is also the additional bulk of fluid and mucin deposits throughout the body. This gives the hypothyroid body a particular puffy, swollen quality that is visible particularly around the face, neck, upper arms, and lower extremities. The abdomen may appear distended, not from fat alone, but from slowed digestive motility and gas accumulation. The ankles and lower legs may appear swollen from fluid retention. The upper arms may seem disproportionately heavy relative to the rest of the body. When you look in the mirror and see not just weight gain, but a kind of puffed, waterlogged appearance that does not respond to normal interventions, you are potentially seeing the fingerprint of thyroid dysfunction on your body. And that recognition could be the beginning of a completely different health journey. The 12th sign is in the quality, color, and appearance of the whites of your eyes. What if looking at the whites of your eyes, the sclera, could reveal information about your thyroid that goes beyond what most people would ever expect to find? While the yellowing of the skin in hypothyroidism from keratin accumulation is relatively well known, what is less commonly discussed is that the eyes also sometimes show a subtle yellowish tinge in their whites for the same reason. Keratin accumulation combined with the mild liver dysfunction that can accompany chronic hypothyroidism. The eyes may also appear bloodshot more frequently than before, not from external irritation, but from the dryness that hypothyroidism causes in the mucous membranes throughout the body, including those that line and lubricate the eyes. The eyes of someone with hypothyroidism often feel gritty, dry, and irritated, and this chronic low-grade irritation can cause persistent redness that people typically attribute to allergies, screen time, or environmental irritants. The overall appearance of the eyes, the puffiness of the surrounding tissue, the pallor of the inner eyelid, the potential yellowish tinge of the sclera, the redness from chronic dryness, the drooping of the upper lid, creates a composite picture that is medically meaningful in its totality, even when each individual element might be explained away in isolation. The eyes, perhaps more than any other feature, accumulate the evidence of thyroid disease in a way that is visible, observable, and deeply informative. The 13th sign is one of the most emotionally charged and personally devastating: the visible evidence of premature aging that hypothyroidism accelerates. What if you have been aging faster than you should? Faster than your peers? Faster than your parents did at your age? Faster than any of your lifestyle choices would justify? Because your thyroid has been failing to produce the hormone that keeps every cell in your body young, energized, and capable of proper repair and regeneration? Thyroid hormone is fundamentally anabolic in nature. It drives the cellular metabolism that repairs damaged tissue, maintains collagen production, preserves muscle mass, and keeps the skin, hair, and nails in the optimal condition associated with youth and vitality. When thyroid hormone is chronically insufficient, the body's repair mechanisms slow, collagen production decreases, muscle mass declines, and the accumulated evidence of this cellular neglect appears on the face and body as accelerated aging. The fine lines deepen more rapidly. The skin loses its plumpness. The hair becomes coarser and thinner. The muscles lose their tone and definition. The eyes lose their brightness. The overall impression becomes one of someone who looks significantly older than their chronological age, older than their twin if you could imagine a version of yourself with a functioning thyroid. This accelerated aging is not inevitable. It is not simply the passage of time. It is a treatable consequence of a diagnosable condition, and the tragedy lies in how many people accept it as their fate when it is actually a symptom screaming for medical attention. The 14th sign is visible in your extremities, specifically in the color and temperature of your hands and feet as reflected in the appearance they present. What if the bluish tinge you sometimes notice at your fingertips, the pallor that appears when you press on your skin and it fails to return to normal color quickly, and the chronically cold appearance of your hands and feet, even in warm environments, are all visible signs of the cardiovascular and circulatory consequences of hypothyroidism? Thyroid hormone plays a critical role in maintaining normal heart rate and cardiac output, and when levels fall, the heart beats more slowly and with less force, reducing the circulation to the extremities. This decreased peripheral circulation creates hands and feet that appear pale, sometimes bluish or mottled, and feel chronically cold, both to the person experiencing it and to anyone who touches them. The skin of the hands in hypothyroidism often shows that characteristic dryness and roughness described earlier, creating an appearance that is simultaneously pale, dry, slightly swollen, and cool. The nails on these pale, cool hands show the changes already described. The overall picture of the hypothyroid hand is something a careful clinician can recognize in moments, and something you can observe in your own mirror, or simply by looking down at your own hands with informed and attentive eyes. Cold hands are easily dismissed. Cold hands combined with the outer eyebrow thinning, the facial puffiness, the dry skin, and the hair changes. That combination is something very different, something that demands investigation. The 15th and final sign is perhaps the most intimate and the most difficult to acknowledge: the visible change in your emotional expression and the quality of what shows in your face when you truly look. What if your face is no longer fully yours? What if the depression, the flatness, the emotional disconnection, the absence of the spark that used to be immediately visible to everyone who knew and loved you is not a psychological condition, but a physiological one, driven entirely by the insufficient presence of a single hormone? Hypothyroidism causes depression in a way that is biochemically distinct from ordinary depression. It is not driven by life circumstances or psychological patterns or serotonin dysfunction in the conventional sense. It is driven by the absence of a hormone that the brain requires to produce neurotransmitters, maintain energy metabolism in neural tissue, and sustain the overall vitality of every mental and emotional process. The face reflects this. There is a flatness, a heaviness, a dimming of the eyes that people who know you will have noticed and perhaps commented on. There is a loss of the spontaneous smile, the animated expressions, the brightness that characterized you before this condition took hold. When you look in your mirror, truly look, not a quick glance, but a genuine, extended, honest look. And the person looking back at you seems diminished, tired, older, flatter, and less alive than you know yourself to be. That observation matters. That observation is data. that observation might be the most important thing you see in your mirror for the rest of your life, because recognizing that something is wrong is the first and most essential step toward making it right again. What if everything you have heard today changes the way you look in your mirror for the rest of your life? Not with anxiety, not with fear, but with awareness, with the profound and empowering understanding that your body is always communicating with you, that it is always sending signals, always writing its story on the surface of your skin and the expression of your face and the condition of your hair and nails, and that the only thing standing between you and that information was the knowledge of how to read it? 15 signs. 15 opportunities your mirror has been offering you every single morning. The puffy face, the disappearing outer eyebrow, the swollen, heavy eyes, the dry, rough, yellowing skin, the brittle, thinning hair, the pale, swollen lips and enlarged tongue, the fragile, ridged, slow-growing nails, the swelling at the base of the throat, the washed-out complexion of anemia, the slowing of movement and expression, the unexplained weight gain with that distinctive puffy quality, the changes in the whites of the eyes, the premature, accelerated aging, the pale, cold, circulation-compromised hands, and the most heartbreaking sign of all, the emotional flatness, the dimming of the spark, the face that no longer fully belongs to the vibrant, energized, alive person you know yourself to truly be. None of these signs alone tells the complete story, but together, as a pattern, as a constellation of connected and meaningful observations, they point towards something that is entirely diagnosable, entirely treatable, and entirely reversible with proper medical care. Hypothyroidism is not a life sentence. It is not an inevitable fate. It is a condition that millions of people have diagnosed, treated, and recovered from, going on to reclaim their energy, their mental clarity, their healthy weight, their hair, their skin, their emotional vitality, and their full selves. The mirror is not your enemy. It is your earliest, most honest, most accessible diagnostic tool. Use it. Look carefully. Look honestly. Look with the knowledge you now carry. And if what you see resonates with what you have heard today, if 2 or 3 or 5 or 10 of these signs feel startlingly familiar, please take that recognition to a physician. Ask for a complete thyroid panel. Advocate for yourself. Do not accept your levels are normal if your body is telling you something different. Do not let another year pass in exhaustion and confusion and unnecessary suffering when the answer may be as simple and as life-changing as addressing a small, butterfly-shaped gland that has forgotten how to do its job. Your health is not a luxury. Your vitality is not vanity. Your life, fully lived, fully energized, fully expressed, is worth every moment of attention and every act of advocacy you give it.